Mabuhay! Kamusta? My name is Dinah and welcome to Positively Pinoy's podcast. In this podcast, I will share inspiring stories and lessons from my Filipino friends around the world and back home. I will talk to Filipino overseas workers who are making a difference in their own ways and Filipinos back home who are excelling in their fields that we can all learn from. So tara na, magchikahan tayo! For this episode, I talked to two Polinian nurses who are working abroad in the US and in the UK. Both of them are among the thousands of Filipino frontliners and nurses helping and caring for patients with COVID-19 while risking their own lives. We talked about the differences of being a nurse in the US and in the UK and how they are handling the pandemic according to their medical system. This is just the part 1 of our conversation, so stay tuned for part 2 on the next episode.
Okay, my name is Marissa and I live in California in Los Angeles and I'm working as a nurse.
You are from?
Los Angeles,
Where
California.
Are you from?
Iloilo. Barotac Nuevo.
Barotac Nuevo. Product of Barotac Nuevo.
Yeah.
Iloilo.
Correct.
Okay, so
yeah.
So there's two of them. So the other one is
Hello, my name is Ken. I'm currently in Cambridge in England. I work in in the hospital in here in the OR, and I'm from Barotac Nuevo as well.
When did you leave the Philippines for abroad? Marissa, now is your MMK story.
Okay, so I left in 2000. I was 18. I was very young, diba? Innocent.
Young, naive, innocent, but ready to party.
Correct.
Okay, Ga, when did you leave the Philippines for Cambridge, England?
I left the Philippines October 2015. I was working as a nurse in St. Luke's for almost 2 years. And then I went directly in here.
Now that you are many years living abroad, what do you miss about the Philippines these days?
Ibos. I miss Ibos. Number
but
one.
But you can easily make that, no? You can? I mean, as long as you have sticky rice.
You don't have the actual
that's true.
coconut leaf.
Coconut leaf. Yeah. Although you can buy in Filipino stores, but it's different.
Yeah.
Iba ang ibos of Iloilo than the regular ibos. So that's number one that I miss.
Oh yeah, that's true. So is Ibos, okay, we need to find this out. Is Ibos like an Ilonggo origin? Because I don't think like it's kind of like
we have to do some research
in Luzon, right? I think it's a very Ilonggo delicacy.
It might well be.
It's different.
Yeah. Okay, so and then what else? Wow, laway to the max. Okay.
Suma, correct. Karen's Batchoy, very Barotac Nuevo, right?
Yeah.
So what else do I miss? You know, just the fact that you can get out of your house in the street, buy barbecue in the street, and talk with your neighbors. That's number one.
Yes, that's true. Yeah.
Because I don't even know my neighbors.
The paho with the
Yes.
Ginamos. Yes. My God, ginapalaway ako subong katanan yung mga tao nag-post sa Facebook.
Ano?
Okay, Langga, what is your, not aside from food and all that stuff, what do you miss about home?
I think first thing is family, of course. And there's no place like home. Obviously, as compared to like, going home and then there's food in the table, you don't have to cook for yourself.
Oh, yes. Oh, my God.
And food, really.
Follow-up question, Kenneth. You're by yourself. You don't have family there.
No. I'm still. I know, but I live with some other Filipinos. Anyway.
Oh,
so you have housemates.
Yeah.
You have housemates.
I don't think I can afford a house anyway. It's just too expensive.
Yeah, I wanted to interview the both of you because, like, among all of my friends, you're the two people who said yes. Yes, to be interviewed about being the frontliners. How did you learn about COVID-19 and how did you react about it? I will start with Kenneth.
Yeah.
Okay, go.
On the news, I think it started December last year. Actually, doka chill lang sa mga tao. I mean, we didn't actually think they would come up here. And then when I think it was starting February or late January, where in Italy was hard hit, that was wherein kind of panic ensued, and then everyone was like very worried. But although initially, so basically on the news, and then in here the government keeps on telling you stuff anyway, which is quite good.
But you're telling me like since December you heard about it.
Yeah,
like,
so it was
kind of rumors.
Yeah, because I traveled January, so before that one, people were kind of talking about it, but it's not like it's a big thing here in Europe.
Ikaw, Amega, how did you learn about it?
Actually, believe it or not, Facebook. But it's more like, oh, okay, it's in China, whatever, you know. And then since I work in urgent care, it's outpatient urgent care. So what happened is I think starting September, we're always on flu season mode. So basically, we always have patients with respiratory problems. So it's more like chill. Okay, it's in China. It's never going to happen. I think we just started realizing that it's big March pa. Maybe end of March, really. Yeah. So from January up until beginning of March, we're just like, whatever, chill. And then we will always get patients that has travel history, let's say Philippines or somewhere else, but we never put them in a negative pressure room. But they have the symptoms. But we never really thought of it. But kasi we go by CDC. So whatever they say. So during that time, they would only say, oh, just as long as the travel history is not in China, we're okay. So for us, it's just like a regular day. We're not really thinking about it.
So speaking of regular day, can you please describe to us what was the normal situation like in your respective hospital before this outbreak/pandemic? Ken, how was it like the normal?
Well, the normal here, we still, because I'm in theater, we normally still carry out elective and emergency procedures. So as we would take kids, everyone really, because we get cancer as well. So as when I arrived in here, we would carry on with lists, and then people still go out, obviously. I mean, normal as we would, you know, and it was like kind of loads of plans already out of for this year. So even myself, I've got like holidays booked, and then some other people have, and then obviously summer is approaching, so barbecue and all that. But that was just it, really. It happened.
But in your hospital, how many patients do you usually have on a...
So it would depend. So,
I mean, like before the whole pandemic. Like what do you usually have in your...
I work with kids and adults in our OR. On a typical list, like say ENT, like tonsils and all that, we could do as much as 9 in a day. Right now we barely do 1 unless it's like cancer or really urgent or something. That's only per theater, and we've got like how many in here? 30 something. So right now I think we've lowered down the capacity to at least only, I think, a maximum of 5 a day or something like that. I'm not really sure, but it's really down to like bare minimum, because we only are allowed to do urgent and I think some of the cancer, and also to free up some of the bed spaces in the hospital. Because obviously if you bring in OR patients, you need to give them pre-op and post-op beds, unless they're day cases, of course. So it's basically way more as compared to right now.
How was it for you? Like, what's the normal like in your hospital or in your area?
Okay, so I have 2 jobs, right? Okay, so my other job is hospital inpatient behavioral health medical unit. So on that floor, we would have like 40 patients. Depends. We run 38 to 40 patients. So it's just normal, you know, they're behavioral health. So not really much of like medical issues. So it's just a typical day. Nothing really. And mga shots, mga Haldol shots, Ativan, if the patient started to go haywire. But it's normal day, and we don't really think about doing PPE because they're just regular patients.
Yeah.
And then in my other job, I work in urgent care. So we see about 300 patients a day. It's walk-in. We see patients with heart problems, respiratory, even as small as having a cut. So it's just typical, just regular flow. So no PPEs, nothing. It's just busy as usual because you never know what you're gonna get for the day. Yeah. So there's really nothing fixed.
So when you learned about like the outbreaks abroad, I guess Italy was like the biggest kind of case for us to get worried.
Yeah.
Okay, like it was really like when Italy was hit, the whole world was like, oh my God, like what's going on? What is it gonna happen to us? Is like after a few days later, France was also like freaking out.
Oh yeah.
I mean, on the medical side, not the population. I mean, there's a hearsay there and there, but nothing like, oh, it's gonna happen to us, but science or the doctors or whatever knew better than us. Did you start to get worried after that? I mean, how was it like in your when you were obviously
I think di ba ang Europe started when? Feb?
It was
Feb or
March.
Yeah.
It was sorry.
Right?
It was in the middle of February. Like
okay.
we were because we were in Italy.
Yeah.
February 9, and then we came back to France, and then boom, self-quarantine because we actually traveled in the northern part of Italy where there was where there was the outbreak. So it was on around February 10, 15 already. Yeah, 15. Around February 20. Yes, about there.
I feel like we didn't really, believe it or not, there's no panic. It's just like, oh, okay, it's in Italy, whatever. We're still okay. We're in America.
It's just like flu. That's what they say.
We're in America. We deal with this all the time. We always have flu. We always deal with the flu season. We always have surge of
it's
different
in here
patients.
as well. Yeah.
So it's like typical. Parang, okay, well, it's just flu, just different strains. So I guess it's okay. So we didn't really think about it.
Did you start to freak out? I mean, in all of European countries, we know that UK was like, kind of the last few ones to really do something about it.
I was supposed to go to the US around second week of March, and I had to cancel it. So that was when it was declared a pandemic. I think that was night before. No, that night it was declared pandemic. The next day I was supposed to fly to LA, and then so I had to cancel it. So during that time, UK was kind of like, it's kind of there, and then people were asked about their travel history and all that. So it's kind of, you could kind of feel that actually they're kind of getting a grip about it. And then I think it was full blown really during around first week of April, around there, because the lockdown started, I think, second week of April. No, was it? No, around first week, somewhere around that, because it went for 3 weeks and it's been extended again, I think, until next week. Just like 6 weeks kind of thing.
It's acceptable. So, we don't know our dates anymore. We don't know what are the
because I remember
which
that
month
was
we are or what.
Because I was on annual leave, and I was Europe was closed during that time as well. So when the borders in mainland Europe were kind of shutting and people were like kind of, oh God, we're having loads of cases every day, the government here were kind of, right, we have to do something. So that's where they were actually saying, oh, we have to do this, we have to do that. And then, eventually lockdown.
Since we came from Italy, so we also try to just keep up with the news. Yeah. Aside from self-quarantine, we're really following what's going on out there.
Yeah.
Because there are already several news outlets who are really like following day by day. Like, okay, what's going on? Where's this pandemic hitting right now? Where? What time? There are actually news outlets that are really doing like a bullet of news on what's going on. So that was very helpful for us, but at the same time stressing us.
Stressful,
and then like Yeah, and then I remember every time Frenchie would come back home after like I think we were already in lockdown. Yes, it was already like a week or something in our lockdown. And then but Frenchie still goes to work, like, because his work is very like 2 minutes walk from
Ah,
here.
Mhm.
okay.
So he's okay. So he works for a school, so he has so many paperworks anyway. But anyway, that's another story. So anyway, I remember him coming home one day and he was like, Bibi. I'm like, what? Like, do you know, like, UK doesn't want to go on a lockdown right now. Like, they refuse to go on a lockdown. Like,
Uh-huh.
oh, I'm so scared for them. I'm so scared.
It
And I'm
was
like,
only late
what?
when they actually stopped the flights and all that, so it was
Mm-hmm.
kind of late.
So
Yeah,
it's like
Yeah.
beginning late March and beginning April.
somewhere around that. Yeah,
Yeah,
Mm-hmm.
so it was like
Mm-hmm.
again like, and then Sweden, there's
Mm-hmm.
Sweden. I don't think they
the
did.
case of Sweden. Yes,
Sweden, I
they
think.
never did up until now. They never did. But then like they're a very
Wow.
special case. They're a very special case. Yeah, I mean,
Amazing.
country-wise, with with their geography or their landmass.
Yeah.
So okay,
I don't know how they do
understandable,
that
and your
actually.
population. But
Mm-hmm.
yeah, so it was like kind of scary for, like, we're the ones who are scared for them basically. But that's
Yeah.
what that's what news gets into you, That's what
You get
happens.
paranoid. Yeah, that's right.
Yes, really.
And
Yeah,
some of them get sensationalized, so
Mm-hmm.
true.
kind of get
Because
what you read, really.
yeah, and there's also
That's
a
why I
lot of
don't.
fake news.
Yeah.
Mm-hmm.
Correct. That's why I don't watch the news.
Yes.
I get
Mm-hmm.
stressed out.
Everyone will be stressed out.
Yeah, I'm
Okay.
like whatever.
So take us to your first experience in dealing with a COVID patient. Like, he's positive,
Yeah.
he's confirmed case. How did it go with
Mhm.
you? Okay, let me
Um,
start with you, Sweet.
I think it was beginning of March because I remember our lockdown was second week of March. So on the time yung New York was
Yeah.
hit, we
Yeah.
already have
Mm.
5 cases here in Long Beach,
Mm.
which is like 20 minutes from our city. So during that time, that's when everybody was like, okay, we need to have a different workflow. So I had this patient, I was telling you about guys in our group chat.
Mm-hmm.
She, believe it or not, she came from the Philippines, right? That's a travel
Mm-hmm.
history. So
Mm-hmm.
we did not really put the patient in negative pressure room. Kasi she just, from the Philippines, during that time, we're still laid
Mm-hmm.
back, so
Yeah.
she's still okay. So I took the patient in. Fever was 103, chest pain, shortness of breath, coughing. So instinct ka doctor is, okay, just go ahead and do EKG. We will do lab draw and we will just do IV fluids and,
Mhm.
IV antibiotics.
The use.
That's it.
Mm-hmm.
And then
Mm-hmm.
I did the flu test kung
Mm-hmm.
see if influenza A and B, and it was negative, right? So we're like, okay, so
Mm-hmm.
she's negative of influenza. But believe it or not, if you're negative of influenza, surely enough, that's COVID. And she wasn't even tested.
Oh.
So yeah, so during that time we don't have kits yet. Kasi
Mm.
it was
Uh-huh.
delayed. It was so delayed.
Mm.
So the doctor was like, okay, so she's negative of influenza. So she probably has infection somewhere else. So we just put the patient in a regular room, discharge the
Might be
patient
pneumonia or
afterwards.
something.
Yeah, or something
Mm-hmm.
else. You know what? The patient came back after 2 weeks and she was admitted. And then the manager called me. She's like, remember this patient? I'm like, well, we see 300 patients a day. So how would I remember, right? It's like, oh, you took care of this patient. She was positive, COVID positive. And during that time, the mode of testing is that it's not the nasopharyngeal swab.
Mm.
It was still the sputum. So it takes about 7 days before you
Yeah,
get
it
the
does. Yeah.
results. It takes a long time. So she's like, well, I just need you to isolate yourself if you can. If you don't have any signs and symptoms, you're fine. You can still go to work, just wear your PPE, blah, 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 blah. And I was scared because I have kids.
Mm.
And
Yeah.
yeah, I have kids. I have 3. So
Uh-huh.
before they called me, actually, I got sick. So I have dry cough, but I
Yeah.
don't have fever.
Right.
And then 2 of my kids who has asthma had asthma flare up. So I was thinking, oh shoot. When they called me, I was thinking, oh shoot, we probably have COVID. We just have strong immune system, so we recovered. So that's what I was thinking.
So you
So
think you had it? You think you
I
had
think
it
I had it.
just be.
Yeah, I think I had.
Mm-hmm.
Just because I
But
was
you were not.
exposed
You
already.
Okay, but let's just be clear with that. You
Mhm.
think
I
you
was
had
not
it,
tested.
you were not tested, you
I
never
was not
knew if you,
tested.
and what else were
Yes.
you feeling at that time? Like aside from, you did not have fever, that's the thing.
I don't have fever, so the only thing that I have is dry cough, which lasted maybe for a week or more than a week, and
Mm-hmm.
it's non-productive. So it's just weird. Yung itching
Yeah,
throat lang
dry
siya,
cough.
and then
That's it.
a little bit of sore throat. That's
Mm-hmm.
Yeah.
it. And I could not sleep at night because I just kind of just cough and cough. And then my daughter, she's 8, so she sleeps with me, and she has asthma. So nag-flare up siya. I have to bring her to the urgent care. We have to do breathing treatment back to back, and my second one too. So I was thinking, you know what, we probably have COVID because they don't have fever. Normally, if they have asthma, if it related to asthma nila, they
Uh-huh.
would always have fever. They would have runny
Uh-huh.
nose, fever, cough. This one just pure cough, dry cough, non-productive cough.
Oh, wow.
So
They also said that part of the symptoms, if you may have it, is
Loss of smell and loss of
uh,
taste.
yeah, lost in
yeah, but
smell and
that's
taste.
that's already parang kumbaga you're already deep into the COVID. Kasi first thing is the dry cough, then you will have like GI problems, and
Uh-huh.
then
Yeah,
you can
I
have
think
the
some
loss of
people
taste and smell.
report diarrhea as well. Because I've got a friend in
Yeah.
London who had it, who tested positive, and then the only symptom I think that he had was the loss of smell and
Yeah,
You
so
know
that's
what?
kind of like in the
That's the
go for it.
thing. Like, that's what I was telling Frenchie. I said, like, there's a reason why Chinese and Asian people, like, only a few of them died. It's because of their nutrients and lifestyle and eating. No, really. Just ko,
True,
that's
very
because
true.
of like mga laswa and tungod. No,
Correct.
I'm serious. I'm really like telling him, I'm like, come on, compare the Asian nutrients and dishes with the
Mm-hmm.
Western people. Like in Asia, in China, in Philippines, in Singapore, in Malaysia, wherever, it's home cooked meals.
yeah.
I
Every
I
day.
mean,
mean, we kind of
home
have a
cooked
lot though.
meals with soup, with veggies, with even if we eat meat, but it's still like soupy or
Mm-hmm.
very nutritious, like very flavorful and like really good food. I mean, come
Yeah,
on, you have
Come
to
on.
agree with me on that.
of
Like there's a good
course.
reason. There's a
Mm-hmm.
good reason why Asian people like, yes, there's no, for me there's no conspiracy theory on that number because come on, like our lifestyle, I mean from birth to, I guess, like for us, when did we start
Uh-huh.
eating junk foods? Like only later in life when we can afford it,
True.
Yeah,
right?
barely,
It's more of
barely.
like,
Even
Yes, or
now.
barely.
Yeah.
Because like we
Mm-hmm.
love good food. We love nutritious, soupy, and vegetarian diet.
Correct.
we agree with you, May.
Correct. Correct. Correct.
Hindi, compare
Yeah.
nyo man. Can you compare a New Yorker's food every
Yeah.
night?
It's hamburger and French fries.
Hamburger, because McDonald's is the
right.
cheapest,
McDonald's.
or Taco
Very
Bell,
Taco
or
accessible.
Bell.
Correct. Correct.
like fast food. It's junk food, so to speak,
Mm-hmm.
and like everything is microwave. I mean, I mean that's their way of life, and that's what they're
Mm-hmm.
Yeah.
used to. But
True.
there's not much of nutrients in their food, but that's because like that's the most affordable food that you can eat. But
Everything's processed. Yeah.
yeah, but they forgot that when you go to Asian store, you get all of these vegetables that are cheap but like good food when you cooked. Like
Correct.
how our mama's gonna cook it. My God. No, really,
True.
that's my I said, like, there's no conspiracy theory there. It's just that Asian like have really good nutrients in their body, and that's why the
Mm-hmm.
antibodies is just there.
We can fight it off.
What about you, Ga? What was like with your first experience with the COVID patient?
So with us when the lockdown, because I was on annual leave for 3 weeks, so I wasn't at
Mm,
work, and then when I came
mm-hmm.
back, that was the lockdown already. So when I came back, there were a lot of measures implemented from that's it, canceling all of the elective cases. So we didn't do much initially.
Mm-hmm.
And then since then, probably the COVID patients were just intubated in ITU. Now, when they can't, because you can only be intubated for maximum 3 weeks, I think. For a second week of intubation, they normally assess you if you could wean yourself off,
You
or
can bring with
you actually
right,
need a tracheostomy. So that was where the time wherein I did manage to handle a case and with COVID. And the thing with COVID is that anything that's aerosol generating procedure, so suctioning, well, if patient coughs or anything that basically goes out of the patient's lungs, even drilling the bone, because that's still aerosol generating. You have to wait 20 minutes after that one for all the aerosols to settle down, and then you could wipe the surfaces and all those things. Anyway, so because we're doing tracheostomy, so that on its own is very risky, because obviously you're putting a tube in the airway, and obviously it's all COVID infested, I must say. So we had PPEs, because it's not urgent tracheostomy, it's elective, and we were provided with PPEs, which is quite good. And then we've always been told that if you think that your PPE is not enough, you're not obliged to come in. So if you're not happy to do it because you've got a leak on your mask, or you don't have this, you don't have that, don't come in. That's simple as it is. And then there were a lot of policies that has been implemented, and up until now, it's still in place. So my experience, first thing was actually, it was scary, obviously, because right away that, this is a COVID, and you know how deadly the virus is. I think it was more of like reassurance on the part of the management of the hospital as well, that you actually have the gear to protect yourself and people around you. But I was scared. Really scared, because as you hear from the news, it just kills people, whether you're young, you're fit, you're healthy, anything. I mean, it will, once you're infected, you could just, the symptoms vary from no symptoms to actually death. So it's like quite a broad kind of spectrum if you think about it. That's why I myself is scared. I mean, I'm one of those people initially actually who thought that it might actually just be flu. And I'm 28, I'm young, I'm fit and healthy, but actually I've got a friend, her classmate died from COVID, so it's not
And
really
how old was she?
it
How
makes
old
me
was
think
she?
that actually you can't be complacent in this kind of disease.
Sure.
So yeah.
Yeah, and I read recently that it also causes cardiac arrest among 30s
Well,
to
because I think
40s
I
patient.
read an article. Well, I don't know how credible it is, but it says it's got something to do with the blood clotting and all that. So it might be connected to that one. And yeah, it's just because I think this virus is so complex that it affects quite a lot of systems in the body, and it really knows how to kill people.
They said we are in a war with an unknown
Biological.
with an unknown enemy.
Yeah, it was
We are
very,
at war
very
with an
scary at
unknown
first,
enemy.
and obviously, because it's like fighting the invisible enemy.
Again, as you said, just because you're young,
It doesn't exclude you.
it doesn't exclude you.
Because there in France, I mean, there was a teenager, like, how old was she? 16 or something like that?
She was 16. She was
High school
16.
student. And I mean, there's no like comorbidities, no asthma or anything. And I said, what is that?
And that just proves the point that,
that on its own,
again, as you said, we can't be too complacent about this, because it can hit you. Again, it's an unknown and invisible enemy.
Yeah,
so
we don't know how. Yeah, we don't know how to treat it. First and foremost, we don't know like what to do. For flu, we have Theraflu that we give to the patient, so that's it, and it helps. But the COVID, we don't know. All we're doing is basically just
very symptomatic.
Symptoms.
Supportive. That's it. Because what happens is it attacks your lungs, and then once it attacks your lungs, you have pneumonia.
That's it.
And then when you can't breathe properly, intubated. That's it.
This is what the doctor that I work with, he makes rounds to ICU. So he goes there one day, and he was telling me, oh, I have this patient, he's only 35 years old. He was healthy, and then he got COVID. He got intubated. He was intubated for 2 weeks, but he would have negative result, and then he would go back positive, negative, positive. So finally, extubated him, but the thing with him is he would have like a parang lifelong ano na siya, lung problem. So
Disability.
30% of his lungs is affected. So even when he recovered 30% of your lung, you lost the functionality of it already.
Yeah.
So what happened to the patient is he's going to be sent to a nursing home to recover for rehab.
Gosh.
That's how hard it hit him. He's only 36.
Blimey.
And
with
Oh
that
my God,
swollen-
we're 38. We're
Yes.
38 years old.
they had
No,
a
and then
study in here that I don't know if it's locally or something, but they said because they plot the like a kind of patient journey from the time you got the symptoms up until you get intubated. So normally they would get intubated or they would die on the 19th day.
Yeah,
So they
because
said
the
because of
longer you stay
COVID-19
in intubation, the
This is like
lesser you will.
COVID-19.
Yeah,
So
the
some people
less.
die on the
Oh
19th day, they
oh my
said.
God. Because
Mhm.
as they said, the longer you are in intubation,
Yeah.
the lesser you are gonna come out of it
Mhm.
alive.
Because
Yeah.
I mean, if you're intubated, you've got quite a lot of things that could go wrong. You can have ventilator
Exactly.
associated pneumonia,
So
and all those things.
So when COVID hit, believe it or not, guys, I have a third job. So this is a nursing home. That nursing home, they have a specialty. They call it subacute. So all the patients there are ventilator trach patients, right?
Okay.
So when COVID hit, they took me out of the schedule because they know that I work in hospitals. So I could possibly bring the virus. I was like, OA, that's so OA. Why are you not giving my schedule, But anyway, it doesn't matter. Now I found out that there's two police, Long Beach police, that stays in the facility to make sure that's how strict they are. Because some of our nursing homes around the area got hit. One of the nursing homes, it's just a regular sniff, not even ventilator patients. They got hit. 22 of their patients are COVID positive, and 10 of the people that work there, nurses, are COVID positive.
We had a local nursing home in here. In 2 weeks, they had 19 deaths.
See?
So here in Europe, or at least here in France, but I know in Spain as well, the most hard hit places are like the home for the aged or like
Nursing
the
homes.
care
the
homes,
nursing
really.
homes,
Yeah.
the elderly
Nursing homes.
Only because they're really vulnerable.
Sure.
Compared to, I mean, if the virus would kill a fit and healthy person, much more with the elderly and all those.
And most of those nursing homes are privately owned. So what happened is, if you're privately owned, you have to give yung ikaw magbibigay ng pera, to fund the nursing home, right? So the government don't really help them. So what happened is they don't buy PPEs for the nurses.
Well, and I think everyone wants to get their hands on the PPE out of the global demand.
That's true. That's what happened here too. Like if we get a donation, let's say we get a donation from this person, right? We have to surrender the PPE to CDC or whatever. That's what they told us, and the CDC will distribute accordingly.
Kind of like make it centralized, and then so that they can.
Yes, correct. Whoever has the most need, I guess.
Because in here it's a National Health Service, so it's like public funded, so they just.
Speaking of PPEs,
yes.
Okay, so in UK where you are, Kenneth, you're provided, right? Like enough.
Yeah.
For all of you, like you don't have to get any donations from private.
We do receive donations, but but I think the government is supplying all at the same time because they've been outsourcing everything. I don't know where to get it from.
Okay, so but you have enough. You have enough PPEs
at the minute,
and masks. Okay.
Yeah.
Okay, so let's go to America, the land
Oh my God.
Milk and honey.
the land of milk and honey. How are you provided with PPEs?
Okay, like you would think we're in America, we should be provided very well, di ba? But it's not. Okay, so yung isa ko na work, where I work in urgent care, it's a big hospital. It's like you're risking your license. Kasi when you work, you go upstairs, you have to sign your name, put your employee ID. Well, they will give you an N95 mask. That mask, you have to put your name, and at the end of the shift, you have to return it so you can use it the next day.
Oh no!
Oh God!
America! Big hospital.
Gosh.
But then as we go along, they kind of got better with yung sa gown. Now they're lending us uniform.
Hazmat suits. Oh.
Yeah, from their yung regular uniform lang to
Okay.
cover our our uniform, and then But what we did in our unit is one of our charge nurses is like, do you guys want me to buy yung pang construction na shield?
Okay, face
Eh,
shield. They call
that
it face shield.
face shield.
Devices.
Face shield
The
na.
visors.
Pang construction worker girl. So I paid $30 for it kasi I do drive-through COVID testing. So we kind of spend our own money.
Oh,
For that
whoa!
Yeah, because
Okay.
I want to protect myself. So
Yeah.
$30, what is $30? So now we're using that construction mask kind of thing. So that's bad. So my other hospital is a smaller hospital, right? Over there, totally no PPEs.
Oh God. Okay.
How about the mask? Do you really have to
You reuse it again?
Yes. If you don't have anywhere to get, so when I go to my other job, I have to get my own mask. And I feel sorry for my other coworkers because they don't have access for that. As in totally wala. So whatever they use for that day, they use the next day. And the next
that's
day.
quite risky because obviously if you're caring for a patient with COVID and then obviously the virus could go outside of the mask.
That's contaminated. Yeah, it's contaminated.
For the next day, what we do with us is that initially actually there was a lot of criticisms with PPE here in the UK out of they weren't actually in guidelines with the WHO, but I think the Public Health England have got their own reasons. But I think right now it's okay. And I could only speak for the hospital I'm working in. Initially, I think they were just using fluid-resistant masks, a plastic apron, and gloves, and obviously that offers no protection with COVID. Because if you see healthcare workers in Italy, they're way better. I mean,
They're the best in the world. Like they're
But I think it's gotten better because what we do here right now is that we use the gowns that we use to scrub in theater, and then gloves, and then you've got visors, you've got FFP3s. I think the most important bit that we had is the FFP3. So we kind of don't have shortage at the minute because I think they had quite a lot of donations from I think factories and all that because I think they use it for their work of some sort. And then obviously the government kept on probably buying and all that. And then even before we used to have some of them because when you have a TB patient, you need to use that one. But at the back of my head, obviously, I said, well, coming from the Philippines, sometimes you talk to a TB patient and it's fine. But in here, they really protect their workers, which is quite excellent. So I was worried because initially, I mean, in here up until now, we use the FFP3 mask per patient. So if you got a patient for this case, you can only use it for that case. May it be half an hour case, 5-minute case, or a 4-hour case. And then you can't use your PPE for more than 4 hours for health and safety reasons.
Oh my gosh, so different.
That's true.
Yeah. So
it's only good for that amount.
Exactly. So if you're doing say a liver transplant or say a laparotomy or something like that, which could take 6-8 hours. So we would take turns. So 4 hours, and then you're gonna get relieved because you could always tell the management. You could always tell your colleagues, look, I'm more than 4 hours. I have to go out now. So I'm quite thankful that happens in here. So yeah, it's good. I think I know a lot of people is criticizing the efforts of the government here, but I'm quite okay with it because at least we get to protect ourselves.
You get something.
You really have the option.
You have something. At
least.
You have something.
Wherein if you're not happy, they said because right now you only have to fit test the mask. They said, if you're not happy with the test, if it's leaking, don't come in. It's as simple as that. So there came a time where in the FFP3 masks, they've got a lot of modules with them. Some of them don't fit me, and then.
But then I have a question. I have a question, Kenneth. When you say, okay, I'm not comfortable, I want to go home. Do they pay you still, or what happens? You lost your hours. How does it go? Because here, when you go home, you're not paid. How does it work with you?
So you need.
Are you paid or
you need to have a valid reason for that. So before everything else, we had this risk assessment from occupational health. And then you've got quite a lot of criteria that if you fulfill it, they're going to give you a color. So if you're a green or a red. So once you're in red, it's either you can be in isolation for 3 months with pay or 12 weeks with pay. Like if you're pregnant, I think if you've got if you're
with pay, that means you're being paid by the government, right? Not the hospital.
Yeah, because we're government hospital, aren't we?
Oh, so, okay. Got it.
So that was it. If the occupational health doesn't clear you with anything, obviously it means that it's not safe for you or you're vulnerable or something like that, then you'll be medically isolated and it doesn't count as a sickness or anything like that, but you'll be off for 12 weeks. I think that was the recommendation. Or if they give you like some provisions that you could only be like a green runner, or you can wear the mask because you don't have a mask that fits you, then that's fine. So that was it. So if the occupational health tells you, okay, you can't actually go to work, then okay.
And then you get paid for the whole amount. Let's say if
Yeah,
you're
yeah.
typically working, you get paid $1,000,
Yeah.
let's say, and then you
Yeah,
still
so
get
you
the
get
same
that.
amount.
Yeah,
Okay.
yeah. Because
Okay.
it's not really your fault that obviously
Yeah.
you can't work.
Yeah, the reason I'm asking is here it's quite different, right? So let's
I've heard.
say
Yeah, we
you
heard,
go,
we read.
yeah, right? So like let's say, okay, I go on medical leave and I don't have enough hours at work to cover my medical leave. So I have filed for medical disability. So the amount of money that I get is not the same amount as to when I'm working. So I probably get, I would say 75% of what I make.
Right.
So if I'm a person with bills, right? I
That's
can't
gonna be hard
afford to
then.
be off. Yeah, so
Right.
that's why nurses could not say I could not go to work. I have to go to work.
Speaks volume of how they're actually managing everything right now in such a pandemic. And as we know, this is not going to be the last one. So
Yeah.
so
Well, I hope
don't
it's not gonna happen another century.
Yeah, no. You know, believe it or not, even before COVID, like maybe a year or two ago, I was even thinking of moving to Canada, right? That's how frustrated I was. As in, let's say,
Really?
example, with maternity leave in Canada, you get paid for the whole year.
Yes,
you can
one
go
Yeah,
year.
in
on
here as
maternity for the
well.
whole year. Okay, here we only get paid 3 months. So,
In here, I
bisan
think you could
gina,
extend it as 12 months. I think, yeah.
see, bisan gina dugo ka pa, day, you have to go to work. So,
And then
Yeah,
I
and
think sick leave in here, they could pay you as long as 6 months in here.
And I've read it. Sorry, I've read it on the news. I've seen it on the news that some states are even, or even in New York, they're telling nurses that if you don't come to work, then you don't have any
that's
job
it.
at all. Like,
Yeah.
yep. That's in the news. That's right there and there. Like, okay, if you don't want to come to work because you feel like you're not safe, you feel like you're not given enough protection, then okay, don't come to work and don't expect that you have a job to go back to.
Yeah.
That's
Gosh.
it. Plain and
That's a bit
simple.
much, isn't it?
It's very frustrating. Very frustrating. I was even thinking about quitting nursing like 2 years ago. It's more like a midlife crisis because that's how frustrated I was.
So I guess this answers my question of like, what's the most challenging part of your nursing job right now? Does this
Diba?
answer the question, Amega?
Right? So, I mean, nursing, just to summarize everything, is very stressful. You need to be mentally stable, physically stable to handle the job. You cannot just go in one day and I'm like, I want to be a nurse. No, you have to be physically and mentally fit to handle it. First of all, here in America, okay, you have a lot of bosses, right? You have the doctors, you have your charge nurses, you have the patient and the family. All of those are entitled. See, when I say entitled, when they want things done, they want things done right away.
That's a very Philippine kind of culture. Because when I arrived in here, people were like, "No."
Okay, so explain your how is it like in the UK? Okay, so what's the big difference?
In here, coming from the Philippines, culture from the Philippines, where and you're not allowed to say no. In here, people would actually ask you always, "So, are you happy to do this? Is that okay?" They're very, very, very polite and they're kind of caring. And then there's this kind of feeling in you that you could actually say no. So, and then people would respect it. So when you say, "Well, I'm not happy to do it," it's fine. Because you're not happy to. Obviously, you've got a reasonable.
You need to have a valid reason, sure.
Valid
Especially
reason for that.
this very trying times, yes.
Yeah, so but in here, because if you feel that the reason is if you feel like say you're not happy to do it because you think it's not safe, then that is better than actually forcing someone to do it and then have disaster right at the end of it. So it's kind of the thinking is very kind of humane, I would say.
Yeah.
Because the culture it's so different. Like in here when you're on a break or when someone is on a break, you can't interrupt them with work stuff because they're on a break. So
Mhm.
there's kind of respect on that one.
Yeah.
And here, when you finish your shift, you could just leave work because you're finished
Yeah.
with your shift, and they can't force you to actually stay because
To stay.
things like that. Yeah.
Okay.
Yeah, that's what we
So,
call life and work balance. And in
yeah, and then
Europe,
in
it's a
Correct.
here,
huge, huge deal.
very
It's a
because
huge, huge deal. Like
also
once you get off work, you
that's
cannot
it.
contact
Yeah.
me about
Yeah.
work.
Exactly.
I'm
They
off.
you can like right now. I kind of get offended when work calls me when I'm there. You know what I mean? You kind of get
Mm-hmm.
into it because just don't bother me with anything. I'm day off,
Mm-hmm.
so
Mm-hmm.
I'm day off. You can't call me to
Yeah.
ask me something like that. So people would be very apologetic when they actually
Mm-hmm.
ring you,
Yeah.
which is fine.
It's the first time like my boss like would sometimes like she would have some because obviously now where everything is online, so
Yeah,
she would just like text me. It's like, I know, Dinah, it's a Saturday, it's a Sunday, I'm
yeah,
so sorry, but I really need something from you. I need your answer right away because we need
yeah,
to like submit this by Sunday night, blah blah blah, like. And
yeah,
I was like,
yeah.
oh, you're saying sorry to me
Yeah.
for asking me something about work on a weekend. Oh
Yeah.
wow.
But
it's
The,
then,
it's it's different. Yeah, it's a
your bosses are,
yeah, they're all
well,
French.
even
I'm the
okay.
even
only Filipino
Filipinos.
and foreigner in the
Yeah,
school.
Okay.
and even
So,
they're Filipino,
le-
it's fine because they
Yeah.
can't do it. You could report
yeah.
them. And then
Mm-hmm.
there's always this. They always tell us there's this flattened hierarchy. So even the chief nurse, you could call them in their first name. It's fine because you could
Yeah.
approach them. You could just tell them. You
Mhm.
could actually tell them off.
Mm-hmm.
If you think that they're actually not doing something that isn't right, you could actually tell them, hey, this is how I feel. I think, blah, blah, and they would listen to you.
Mhm.
So that's one of the biggest thing I think.
Okay, elaborate ko lang the reason why I'm saying it. Okay, so
No, it's fine.
being in nursing here in America for like 15 years, I've been everywhere.
Gosh, yeah.
So
Mm-hmm.
I'm saying, okay, I work in a nursing home where the directors and most of the people in management are. So
Mm-hmm.
when they're
Okay.
working with a Filipino nurse, they kind of intimidate you and they always say, no, you have to do it, blah, blah, blah. And you being a Filipino, yung nakikisama ka, and they're
Mm-hmm.
older than you and
Mm,
more superior than you tend to follow. But when they deal with different race, let's say itim, puti, they don't do the same treatment. I'm
mm.
Mm-hmm.
just saying. And then when I first started, I was training with a Filipino nurse, a little bit older than me, like a lot older. So she would get upset with me. She would intimidate me. So that's why I'm saying, and I could not say no, and I could not report as a
Yeah.
Filipino,
Mm.
right? So when
Mm-hmm.
I moved to bigger hospitals, like they have this thing where they want to please the people that they work with, but their hands are tied. But as far as the management, they would always make sure that you're okay. Is your doctor okay? They always have that evaluation about the attitude, the management, and everything. So that I'm happy about. It's just that some things, their hands are tied. They could not really do
Yeah.
anything about,
Yeah, because
So
again, like
it depends.
working, sorry, because like
Yeah, go
the
ahead.
culture, we're so used with the culture, the pleasing culture. We're people
Yeah,
Mm.
so
pleasers.
you're just a people pleaser, and then even Filipino nurses in bigger hospitals, their attitude changes. As Filipinos, they work 2-3 jobs, right? So one
Mm-hmm.
Filipino would be working in that bigger hospital. They work with you, and they're different. Once you go down to the nursing home and you work together, the attitude changes drastically. So para
Mm.
that's why I was asking, your employer is foreign or is it Filipino?
Oh,
Because
I
it makes a
see.
big difference. Yeah,
Now in here, we've got a lot of Filipino managers, but
they're
they're
still
okay. I
the same.
mean,
Mm-hmm.
yeah, yeah,
Because
because
again, it goes with the culture. It goes with
yeah,
like
Uh-huh.
yeah,
you need to adjust obviously with the
mm,
culture.
Uh-huh.
So
Tama.
because I guess I would say that somehow American culture, obviously because we were under their influence for quite some time as well
well, up
historically.
until now, I
So
think.
Uh-huh.
there's still that kind of like mentality.
Mentality. Mostly when I work with fellow Filipinos talaga, I could say.
Mm-hmm. Mm-hmm.
But then with
Yeah.
other lahi, it's different.
Mm-hmm.
Yeah,
Oh my God, that's a lot of learnings for
I
me.
know.
Right?
Yeah.
Yeah.
Maraming salamat sa pakikinig. You can subscribe or download to this podcast on Spotify, iTunes, and YouTube. Just search for Positively Pinoys. See you next